Health Secretary Ted Herbosa that there are instances when patients in hospitals are forced to purchase expensive branded medicines from the hospital pharmacy. Minsan pa, walang choice ang pasyente sa branded o generic pag nirasyon na ng nurse ang mga gamot. Sa hirap ng buhay, naniniwala po ako sa dihikain ng Generics Act natin dahil kawawa po ang pangkaraniwang mamamayan na walang pambili ng gamot. I was surprised when Secretary Herbosa said that there are instances where doctors really prescribe branded medicines because sometimes it is more effective and more potent. Sinabi ko po sa kanya, kung ganun pala, bakit dapat hindi na-aproba ng FDA ang nasabing generic na gamot kung wala naman pala itong bisa? Mas lalong mapapamahal si Juan de la Cruz. Kung ang murang gamot ay hindi naman pala gumagana, dapat dumadaan talaga sa masusing pagsisiyasat ng FDA ang mga ito. Nung nasabing hearing na yon, ko na inilatag kay Secretary Herbosa ang issue tungkol sa mga junket trips ng mga doktor sa iba't ibang bansa kung saan sponsor ang mga pharmaceutical companies. Medyo nagtalo kami ni Secretary Herbosa dahil dito sabi niya bawal na daw ito dahil tayo ay signatory ng Mexico Protocol kung saan bawal ang mga medical professionals na tumanggap ng mga benefits or gifts from pharma companies. Sabi niya, sinusunod daw ito ng mga medical organizations. Ang hindi ko po maintindihan, bakit ayaw aminin ni Secretary Herbosa ang rampant na practice na ito?
Hoy, 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 hoy. Umisig ka na Pinoy. Hoy, 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 hoy. Umisig.
President, esteemed colleagues, and ladies and gentlemen, today I rise before you with a heavy heart and a sense of moral obligation to shed light on a matter of grave concern within the medical community. It saddens me to say that a significant conflict of interest and unethical behaviors have seeped into the medical profession, compromising their commitment to prioritize the well-being of their patients above all else. Reports have come out that certain doctors have become entangled in the web of a pharmaceutical company that shamelessly peddles its products through a deplorable multi-level marketing scheme. Mr. President, my dear colleagues, an all-Filipino-owned pharmaceutical company engaged in distributing anti-hypertensive, anti-diabetic, antibiotic products, and health supplements nationwide, called Pharma Incorporated, is at the center of this issue. Maliban sa ilan sa kanila, napag-alaman ko na ang kumpanyang ito ay binubuo halos ng mga doktor, mga espesyalistang doktor. Sa datos mula sa Securities and Exchange Commission, ang mga tumatayong direktor o officers ay sina Luis Raymond Go bilang presidente, Alina Fatima Hojilla bilang vice-presidente, Joseph Vincent Go, corporate secretary, Jaime Cayetano Jr., treasurer, at 58 iba pa na stockholders na pawang mga doktor mula sa iba't ibang panig ng ating bansa. Karaniwan na nating narinig ang mga insentibong binibigay sa mga doktor at nakasaad naman sa Philippine Medical Association Code of Ethics na maaari silang tumanggap ng mga regalo. Nakasaad din sa Article 6 na only gifts of reasonable value that primarily entail benefit to patient care or related to physician's work may be accepted by a physician from a health product company. Ganito rin ang nakasaad sa the Mexico City Principles, ang itinuturing na International Code of Business Ethics sa biopharmaceutical industry na nindorso ng APEC noong 2011 at kung saan ay signatorya ang Pilipinas at pinatutupad ng DOH sa pamamagitan ng Administrative Order 2015-0053. Ang mga doktor ay pinagkatiwalaan ng isang sagradong tungkulin na itaguyod ang pinakamataas na pamantayang etikal na pag-uugali at pagbibigay prioridad sa kalusugan at kapakanan ng mga taong nagtitiwala sa kanilang pangangalaga. Nakasaad ito sa Hippocratic Oath na kanilang sinumpaan. Sa kaso ng Belkens, mukhang nakalimutan ng mga doktor sa likod ng kumpanyang ito ang sinumpaang oath at iba ang pamantayan nila. Kung kadalasan na nating narinig ang kaliwat kanan na sponsored na trips abroad sa mga doktor at stakeholders ng pharmaceutical companies, ang Belkens ay namimigay ng cash incentives na umaabot sa milyon o kaya naman ay mga mamahaling sasakyan na nasa milyon-milyong halaga rin. This company, which has been in operation since 2006, shamelessly recruits doctors, not medical representatives, into its fold, enticing them with promises of exorbitant commissions and lavish incentives in exchange for prescribing their medicines, a blatant violation of their ethical principles, betrayal of trust bestowed upon them by their patients, and a flagrant disregard for the sacredness of their profession. Under the guise of advancing medical science and improving patient outcomes, these doctors-turned entrepreneurs exploit their positions of authority to promote and prescribe medications that may not necessarily be in the best interest of their patients. They prioritize profits over patients, prioritize their financial gains over the well-being of those they have sworn to serve and protect. Mr. President, my dear colleagues, allow me to walk you through their business scheme. Ang mga nirecruit nilang mga doktor na bubuo ng core group ay tinatawag na Jedis. Dahil mahilig sa Star Wars, ang mga may-ari ng kumpanya na sila Dr. Luis Go, Berwin Flores at James Cayetano. Not everybody can be part of this group. Only doctors who are recommended by a Jedi and all other Jedis will be accepted. If there's one Jedi who disapproves of a particular doctor for whatever reason, that doctor cannot be a Jedi. They do this approval process via the Jedi Viber group. The reason why a Jedi recommends a doctor is mostly based on friendship, practice, and influence. Belkens started predominantly with a group of cardiologists. Gradually, they tapped endocrinologists, diabetologists, pulmonologists, neurologists, internists, and family physicians. The recommended Jedis go through the nurturing lecture conducted by Dr. Luis Go. The objective of this lecture is to teach doctors financial freedom and that Belkens is the only pharmaceutical company that can make it possible. Their productivity is regularly monitored, and once they reach the target productivity, they level up to Jedihood. Once already a Jedi, they can enjoy all the benefits of a Jedi, and these are the following. Number 1, 8% rebates based on monthly productivity, usually around 2 million pesos. Milestone point. Under the milestone program point system, 1 point is earned from the minimum 2,700 worth of prescribed brand sales. Earned points can be used for redemption of items such as gadgets, household items, or foreign travel. 1 point is equivalent to 100 pesos. Yearly performance bonus based on the percentage of the total contributions of the sales of Jedis against all of the Jedis. Number 4, dividends and growth of sales, which is based on the total number of shares the doctor holds. Number 5, and on top of that is what they call as the annual Jedi Star Tour. Depende kung na-hit ng doktor ang kanyang 3.5% productivity target, maaari silang bigyan ng Asian, European o US tour package. At panghuli, nanggagaling naman si rebate sa mga cash or luxury items tulad ng dream car nila. Convertible sa mga cash, mamahaling kotse, Rolex, at iba pa ang mga naipong rebates. Para maging Jedi, kailangan nila mag-prescribe ng mga gamot ng Belkens, maging mga supplements na ibenta ng kumpanya, kailangan man o hindi ito ng pasyente. nasa 250,000 hanggang 500,000 ang entry level ng investment nila. The Jedis also earn from the prescription of the downline doctors they recruit. If the downline doctor is not an investor, the recruiting doctor earns a 6% rebate from every prescription of company products made by the downline doctor. The company also has a category of second investors who are called padawans. In the fictional universe of the Star Wars films, a padawan is a Jedi apprentice. They do not have downline doctors. Padawans are entitled to receive dividends and rebates and earn milestone points. Unlike other pharmaceutical companies, the Belcan's model is different, and doctors tend to stick with it because of its attractive benefits. Most of them are enticed by the leveling up scheme. Dahil madami silang na-recruit, natural lamang na mabilis ang paglago ng kumpanya. Mula sa 1 billion na benta noong 2016, tumas pa ito, tumabot sa 3.2 billion noong 2018 at 5 billion noong 2019. The scheme is not only about making money, but also hurts the credibility and integrity of the medical profession. The doctors who engage in such unethical practices undermine public trust in healthcare professionals and cast a dark shadow over the noble work of dedicated physicians who strive to uphold the highest ethical standards. We cannot allow this unethical conduct to continue. It is our responsibility to denounce and eradicate such practices. Nakapanlulumong isipin na habang pinipilit nating nagawing abot kaya para sa mga mahihirap nating kababayan ang presyo ng mga gamot sa pamamagitan ng mga pagbibigay ng diskwento, gaya ng Senior Citizens Act o ang batas na nagpalawig ng benepisyo ng mga persons with disabilities o PWDs at iba pa, ay may mga doktor na nagdadagdag ng mga pasanin sa kanilang mga gastusin. Under the Generics Act of 1988, all medical, dental, and veterinary practitioners, including private practitioners, shall write prescriptions using the generic name. The brand name may be included if so desired. Nakasaad din sa batas na mga drugstores at iba pang mga kagaya nito ay may responsibilidad na ipaalam na bumibili ng na maaari silang bumili ng ibang produkto na may kahintulad na generic name. Dapat binibigyan ng karapatan na bumibili na makapamili at hindi matali sa brand na inirekomenda ng mga doktor. Maaring masuspende ang lisensya ng doktor kung hindi susunod sa kautusan ng batas na ito. Mr. President, while it is not illegal for medical practitioners or professionals to engage in business activities, it is highly unethical when a pharmaceutical company owned by doctors hires other doctors as agents and pays them commissions based on the prescriptions they give to their patients. This practice becomes even more concerning when these doctors are also required to meet a quota for the number of prescriptions they give out. This type of behavior is not only unethical, but also prejudicial to the well-being of Filipino patients. To prescribe drugs from doctors who are agents or distributors of Belcans is a clear conflict of interest under the Mexico City Principles and the Code of Ethics for Doctors. The trust and confidence that patients place in their physicians are paramount. To preserve this trust, medical practitioners must adhere to the highest ethical standards. This includes the strict prohibition on physicians benefiting financially from the medications they prescribe as established by various international protocols. Such a measure ensures that patients' welfare remains the top priority in all medical decisions, free from any financial bias. In bringing to your attention this matter, I implore you, Mr. President, my dear colleagues, to condemn this reprehensible exploitation of some medical practitioners for personal gain. May I emphasize, Mr. President, that those allegedly involved represent only a fraction of our country's more than 28,000 practicing doctors. Hindi ko po sila nilalahat. Naniniwala ako na mas nakakarami pa rin ang mga kababayan natin doktor ang nananatiling tapat sa kanilang sinumpang tungkulin alinsunod sa kanilang code of ethics. I move to have this issue investigated by the appropriate committee to enable us to craft the needed legislation. It's probably high time that we come up with a legislation similar to the United States, the anti-kickback statute, a criminal law that prohibits the knowing and willful payment of remuneration to induce or reward patient referrals or the generation of business involving any item or service payable by the federal healthcare programs. And as I close, I urge our medical professionals to reaffirm their commitment to the Hippocratic Oath and reassert their dedication to the highest ethical standards of medical practice. The Filipino people deserve nothing less than your unwavering devotion to their health and well-being, free from the influence of greed and self-interest.
If you remember, last April 2, 2024, our hardworking senator from Davao, Senator Bongo, conducted a hearing for the Committee on Health and Demography, where I raised several concerns in the medical community. One is the bullying of residents by their senior consultants. And after that, Mr. President, it opened a can of worms, if you will, dahil sunod-sunod po natanggap ko na mga tawag mula po sa medical community, particular na po mga doktor, because they want to clean their ranks, and they came to me voluntarily to offer information that would help na para mapaganda po ang pamamalakad sa ating medical community. Now, I also raised the question about the violation of the Generics Act of 1988. I mentioned to Health Secretary Ted Herbosa that there are instances when patients and hospitals are forced to purchase expensive branded medicines from the hospital pharmacy. Minsan pa, walang choice ang pasyente sa branded o generic pag nirasyon na ng nurse ang mga gamot. Sa hirap ng buhay, naniniwala po ako sa hikain ng Generics Act natin dahil kawawa po ang pangkaraniwang mamamayan na walang pambili ng gamot. I was surprised when Secretary Herbosa said that there are instances where doctors really prescribe branded medicines because sometimes it is more effective and more potent. Sinabi ko po sa kanya, kung ganun pala, bakit dapat hindi na-aproba ng FDA ang nasabing generic na gamot kung wala naman pala itong bisa? Mas lalong mapapamahal si Juan de la Cruz. Kung ang murang gamot ay hindi naman pala gumagana, dapat dumadaan talaga sa masusing pagsisiyasat ng FDA ang mga ito. Nung nasabing hearing na yon, ko na inilatag kay Secretary Herbosa ang issue tungkol sa mga junket trips ng mga doktor sa iba't ibang bansa kung saan sponsor ang mga pharmaceutical companies. Medyo nagtalo kami ni Secretary Herbosa dahil dito sabi niya bawal na daw ito dahil tayo ay signatory ng Mexico Protocol kung saan bawal ang mga medical professionals na tumanggap ng mga benefits or gifts from pharma companies. Sabi niya, sinusunod daw ito ng mga medical organizations. Ang hindi ko po maintindihan, bakit ayaw aminin ni Secretary Herbosa ang rampant na practice na ito? Wala daw po siyang knowledge na rampant ito. Sabi niya, ang junket ay nung araw nangyayari bago na pirmahan ang Mexico Protocol. Pero kung meron daw may mga regulations na pwede namang kasuhan ng mga pharmaceutical companies na lumabag dito, paulit-ulit siya niyang sinasabi na kasuhan ng mga pharma companies. Ang pinagtataka ko po, hindi pa it takes two to tango. Dapat may liability din ang mga doktor. Medyo marami pong hindi natuwa sa akin sa medical community. Gusto ko po linawin, malaki pong respeto ko sa medical practitioners. Sabi po, sila po ang ating mga frontliners and they have proven time and time again na sila ay mga bayani. But this lukewarm reception of my concerns is what bothers me. Bakit parang hindi bothered ang DOH? Talaga bang walang dapat ikabahala? Hindi po. After the hearing, ang daming nag-confirm ng mga sinabi ko. Mga doktor po mismo ang lumapit sa akin after that hearing. Apparently, I opened a can of worms in the medical and pharmaceutical industry. Mr. President, a well-respected doctor approached me regarding a multi-level marketing scheme involving doctors and a certain pharmaceutical company, the Belkens Pharmaceutical Incorporated, in existence for 17 years. Under the scheme, doctors are given gifts, watches, cars, cash, etc. for them to meet their quota. They also earn from doctors in their downline. Under the scheme, ang mga doktor ay pinipilit ang mga gamot sa mga pasyente kahit hindi po kailangan ng pasyente. They even have coaches who monitor and supervise them in pushing the products. The pharma companies are able to track the activities of these doctors and determine who are indeed delivering and performing well. Ibig sabihin, nakamonitor po ang aktibidad ng mga doktor base po sa kanilang mga pagreseta. While it is not illegal per se, on the part of doctors, it is unethical and immoral. Mr. President, our people are barely making ends meet, and rarely do they have medical expenses counted on their monthly budget. Kaya po, pag may nagkakasakit, bawat sentimo ay mahalaga. This MLM scheme is troubling for the medical community for several reasons. Una, malamang hindi nag-iisa itong kumpanyang ito. Ang balita ko, dahil dito lang sa Manila, sila nagko-concentrate, ngayon lumawak na sa probinsya. Dati sa mga cardio department lang, cardio department. Ngayon, mas maraming department na ang gumagaya. Pangalawa, kawawa naman ang mga may sakit dahil siya ay napipilitang bumili ng mga gamot na hindi naman pala nila kailangan. Sayang ng pera nila dito, baka lumala pa ang kanilang sakit. Pangatlo, this puts the medical field in a bad light. Patients are going to second-guess the prescription of their doctors. Sa medical field, there is premium on trust because it is a specialized field na hindi naman naintindihan ng pangkaraniwang tao. So kung wala kang tiwala sa doktor, bakit di ka nalang pumunta sa doktor? O i-google na lang ng mga tao ang sakit nila, and that is very dangerous. We have to review the Generics Act of 1988 and the Universally Accessible, Cheaper and Quality Medicines Act of 2008. Kasi nga po, si Secretary Herbosa mismo nagsabi na may mga gamot na hindi clinically effective. Sinabi po yan mismo ni Secretary Herbosa, galing mismo yan sa kanyang bibig, na meron daw po mga branded na gamot, na meron daw po mga generics na gamot na hindi raw po effective, kaya hindi raw niya po yan piniprescribe nung siya po ay nagpa-practice pa bilang isang doktor. Not all medicines are created equal. Some have varying bioefficacy and bioequivalence. Kung ganun pala, bakit hindi ito in-address ng FDA? Why do we approve generic medicines and tell people that it is the same as branded ones kung hindi naman pala ito epektibo? I still believe in generic medicines, pero dapat it should really be equivalent to branded ones insofar it is clinically effective. The FDA is to be at the forefront of this concern. What tests are they doing to check on the potency of these medicines? Paano nakapasok sa merkado ito mga ineffective na gamot? Malawak ang sakop ng mga scheme na ito sa pharma industry. Kasamang FDA, mga opisyal ng ospital na in charge sa procurement, mga doktor na nagbibigay ng prescription, at pati sa mga drugstores na minsan sinasabi ay wala ng stocks na mga generic medicine para lamang mabenta ang branded. Or sinasabing wala ng available na mga branded medicines para mabenta lang ang mga generics medicines. Nagkasanga-sanga na po ang problema. Ang tawag po dito ay switching, na kuminsan ay kasabot din daw po, unfortunately, ay mga tao na nagbabantay sa butika. Isa pang lumapit sa akin after the hearing sa committee ay ang sumbong ng isang doktor sa Bulacan. Ang concern niya naman ay practice ng isang doktor na nagkakandak ng multiple pterygium surgeries in a day. Minsan, 38 surgeries sa isang araw. At ang requirement niya sa mga tao ay basta may PhilHealth ID. Libre na ang surgery mo. Siya ay nakakapag-claim ng 30,000 surgery per eye. He recruits patients from different towns and barangays. It has been 2 years since the doctor reported this sa PhilHealth pero wala pong nangyayari. Ibig sabihin, matagal na pong nireport po sa PhilHealth itong modus ng isang doktor sa Bulacan pero ang PhilHealth nagbulag-bulagan at nagbingi-bingihan o marahil merong kasabwat ang doktor na ito sa loob ng PhilHealth. Marami pa rin po siyang narinig na ganito mga fraudulent procedures. Ang PhilHealth pilit na pinagkakasya ang naokolekta upang matugunan ang mga pangangailangan ng taong bayan ay iniisahan pa ng mga doktor ng ganito. It's about time na may magbantay sa mga ginagawa ng doktor. Opo, Mr. President, nandyan nga yung Professional Regulations Commission sa tulong ng Board of Medical Examinees. Pero mawalang galang na po sa mga taga-PRC. Daig nyo pa po ang pagong kapag kayo po'y kumilos dyan. Ang dami ko na po natanggap ng mga sumbong na kapag kayo po ay nagpalabas ng inyong resolusyon sa isang reklamo, that after 5 years, kuminsan after 10 years, kuminsan patay na ang pasyenteng nagreklamo. Bakit napakabagal umaksyon ng PRC sa mga reklamo ng medical malpractice? Sa magkanong kadahilanan? The Board of Medical Examiners have to police their ranks. They have to protect industry from these unscrupulous and greedy doctors who put their financial interests ahead of their duty to providing health care to the people. Mr. President, our doctors should be put at a higher standard compared to other professions. According to the Supreme Court, the medical profession directly affects the very lives of the people, unlike other careers which, for this reason, do not require more vigilant regulation. I hope that to the Committee on Health and Demography, we can end these schemes that harm the medical field and our people. I believe there is a need to put stiffer penalties for these unethical and immoral acts. They must be declared illegal. Finally, it will be useless if these laws could not be implemented by a competent disciplinary board. The PRC must go to the bottom of why administrative cases filed against doctors are not resolved. Finally, FDA must review its procedure in regulating the pharma industry to ensure only quality medicines are given to patients. It is the policy of the state to protect public health, and when public interest or circumstances of extreme emergency so require, it shall adopt appropriate measures to promote and ensure access to affordable quality drugs and medicines for all. That ensure that these are not just words, but a reality for our people. Thank you, Mr. President. Salamat.
President, as I committed to the Majority Leader, this is very short. It really just is a matter of jurisdiction. I chaired the Committee on Health for many years, and similar issues were brought up. But at the end of the day, Mr. President, if this involves government agencies who are not doing their jobs faithfully, then it would be a matter for the Blue Ribbon. So I will leave that decision, the discussion for that decision, till after all the interpellations are done and after conferring with the chairman, of course, of the Committee on Health and the sponsors of the two privileged speeches. But I do want to bring up that in both speeches that were delivered today, both gentlemen referred to the DOH and the FDA and then the PRC and asked the questions, what are these agencies doing about it? So on that note, and if they are failing to do their job, then that becomes a Blue Ribbon issue, Mr. President. Thank you.
Colleagues, for the record, we have earlier sought an inquiry on the same issues raised by Senators Estrada and Senator Tulfo. We have filed proposed Senate Resolution number 1011, which will be discussed in tomorrow's hearing under the Committee on Health. Our objective is that since doctors mismo, Mr. President, ang unang naglabas sa media ng mga alleged collusions between doctors and pharma, we just want to know if it's within the ethical bounds by itong mga nireklamo ng kapwa-doktor nila. We also want to know if nakaka-apekto kaya ito, no, itong multi-level marketing scheme being employed to the prices o sa presyo ng gamot because we passed Universal Healthcare Act, Generics Act, specifically to lower down the cost of medical expenses. And Mr. President, considering that more than 50% of the out-of-pocket expense of health expenses accounts to medicine and pharma. We want also to emphasize, Mr. President, that hindi natin nilalahat ang lahat ng doktor. Marami sa kanila ay mga mabubuting tao. They are all good people and good servants. Kaya we need to probe this issue so that the people trust in our doctors will remain solid. But issues raise several ethical, legal, and policy questions. First, it contravenes many regulations and protocols meant to insulate doctors from undue influence. Second, ano ang epekto nito sa ating cost of healthcare? We passed the UHC, as I mentioned, para babaan ang out-of-pocket expenses. For the record, that's been lowered to 44.7% in 2022 compared to more than 60% before UHC was passed. Pero para saan po ito? If a few individuals will just prescribe pricier drugs and unnecessary supplements. That's all, Mr. President. I look forward to a clear and comprehensive discussion of these issues in tomorrow's hearing under Senator Bongo. Maraming salamat.
A brief manifestation tungkol sa kaugnay pero importante ring issue na nabanggit ng good gentleman from Isabela sa kanilang privilege speech. Sinalaysay po nila sa atin na sinabi ni Health Secretary Erbosa na may mga generic medicines na hindi effective, kaya hindi niya masyadong pine-prescribe. At merong ding binanggit, ayon sa good gentleman na mula sa Isabela, si Sec. Erbosa, tungkol sa bioequivalence, na hindi lahat ng generic medicines ay may bioequivalence sa mga branded na gamot. Humihingi po ako, Mr. President, ng importanteng paglilinaw mula sa Health Secretary dahil yung mga issue na binanggit nila ay ilan sa importanteng kasama sa ipinasa nating matagal ng Quality Affordable Medicines Law o Cheaper Medicines Law na mula sa House of Representatives noon, magkasama kami ni dating Representative Juni Cua. At dito naman sa Senado, naalala ko po ang aming counterparts noon ay si dating Senador Mar Rojas at ang Gentle Lady mula sa Taguig and Pateros. At itong mga kaugnay na issue na binanggit din ni Sec. Erbosa ay nasa heart and soul ng generics law. For the record lang and briefly, Mr. President, a generic drug is a pharmaceutical drug that contains the same chemical substance as a drug that was originally protected by chemical patents. Kaya't importanteng bahagi ng cheaper medicines law. Further, a generic drug has the same active pharmaceutical ingredient o API as the original, but it may differ in some characteristics such as the manufacturing process, formulation, excipients, color, taste, and packaging. At huli, Mr. President, for the record tungkol sa bioequivalence is the biochemical similarity of two or more drugs that share the same active ingredient or ingredients and desired outcome or outcomes for patients. Hanggang ngayon, Mr. President, napakahirap ngang i-implementa ng kompleto at maayos yung generics law at yung bahaging iyon sa cheaper medicines law. Para lahat po ng ating mga butihing doktor ay isulat talaga ang generic equivalent sa reseta, or yun ang unang isusulat, at kasunod lamang kung meron silang recommended na branded medicine, at na lahat ng ating mga pharmacists sa mga butika ay dapat sinasabi din sa customer kung may i-order silang branded medicine, kailangan sabihin, ma'am, sir, merong pong generic equivalent. May bioequivalent kasi imbisa at di hamak na mas mura para i-encourage yung sinasabing rational drug use na hindi tingi-tingi mapipilitang bumili yung ating mga kababayan dahil hindi nila afford yung buong reseta ma-afford sana kung generic talaga ang isusulat ng ating mga doktor at generic talaga yung ipapayo ng ating mga pharmacist para ma-discourage na di nila makumpleto yung buong treatment plan na nireseta ng doktor. Pag nagkasakit sila ulit, meron ng resistensya yung katawan nila sa gamot na yan dahil hindi nila nakumpleto. So, pahingi lamang po, Mr. President, mula sa pamamagitan ng Senado kay Sec. Herbosa ng klaro at napaka-importanteng paglilinaw para ma-encourage, hindi ma-discourage yung ating mga kababayan tangkilikin ang generic medicine. Salamat kayo, Mr. President.
I joined the gentleman from San Juan and Zambales in his call to look into the issue and uphold patients' rights. This issue was briefly raised by Senator Raffy Tulfo during our April 2 hearing of the Committee on Health. As chairperson of the Committee on Health and Demography, I would like to inform the body that the committee will conduct a hearing tomorrow at 10 a.m. on the alleged multi-level marketing scheme involving a pharmaceutical company and some doctors allegedly owning some shares in the company, prescribing and aggressively encouraging patients to buy prescription medicines distributed by said company. We are conducting this investigation because it is the state's mandate to ensure the integrity of our entire public health system and to assure our people that those given the privilege to exercise their medical profession remain faithful and true to our laws and their ethical standards. Our objective is to uphold ethical standards in the medical profession and protect the rights of patients to appropriate medical care, information, and informed consent. Dapat po'y unahin ang kapakanan ng pasyente, hindi po ang pharmaceutical companies. Kalusugan po ang nakataya dito. Ang katumbas po ng kalusugan ay buhay ng bawat Pilipino. At Mr. President, gusto ko lang pong linawin. The President and CEO ng Belkens, nabasa ko kanina, Luis Go For the record, hindi ko po kamag-anak yan. Go pala ito Mas lalo kang lagot sa akin. Kung mapatunayan po na totoo yung aligasyon. Nagkataon naman po na maraming Go sa Pilipinas. To Go, Go Hotel, Chokes to Go. Yun, suki mo. Anyway, hindi ko po kamag-anak yan. At lalo pong hindi ko kaano-ano ang Go na nananamantala sa ating mga kababayan. Hindi naman po masamang magnegosyo, pero ito mukhang networking na po ito at pyramiding na po. Pag pumasok na yung negosyo sa kalusugan, ay hindi na po tama yan. At nabalitaan ko nga, namimigay ng BMW. Kawawa naman yung mga doktor na naka-BMW at walang kinalaman. Alam nyo, most of our doctors are very professional at may kaya po itong mga doktor na to. Pinaghirapan nila yung profession nila. Kayang-kaya nila bumili ng BMW at Mercedes-Benz. At ako po most of our doctors are trustworthy at pinagkakatiwalaan. Kaya nga po, ipinagkatiwala natin sa kanila ang ating kalusugan. As chairman po ng Senate Committee on Health, pinapriority ko po ang mga mahirap, lalong-lalo po yung pasyenteng walang pambili ng gamot. Kung ganito ang ginagawang sistema, pinagsasamantalahan na po ang mga pasyente. Nawawalan po ng choice ang pasyente kundi sundin yung reseta kahit mahal na po ang gamot. Nagiging negosyo na po ang paggamot, hindi na po interes ng pangkalusugan. Pinagkakakitaan na, sa huli, ang talo dito yung mga pasyente, lalong-lalo na po yung mga mahirap. Ulitin ko, unahin po natin ang pasyente, hindi po ang pharmaceutical companies. Noong panahon ni dating Pangulong Rodrigo Duterte, nag-issue siya ng executive order imposing a maximum drug retail price para babaan po ang presyo ng mga pangunahing gamot. Having said that, Mr. President, I just want to point out that most doctors are known to be very professional, kaya nananatili malaki po ang aking tiwala sa ating mga doktor at mataas ang respeto ko sa medical profession. Napaka-sensitive na trabaho po ang kanilang ginagawa at napaka-importante po ang integridad sa kanilang profesyon. Concerned tayo dahil ayaw nating dumating ang panahon na mawala ng tiwala ang publiko sa mga reseta ng mga doctors natin. Sa mga payo ng mga doctors natin dahil lang umano sa iilan lang pong mga tiwaling individual. Alam naman natin ang dakilang sakripisyo ng ating mga medical doctors at hindi natin matatawaran kung yung kanilang sakripisyo sa panahon ng pandemya, hindi po natin mararating ito kung hindi po dahil sa kanila. Marami sa kanila nagbuwis po ng buhay at nagkasakit sa panahon ng COVID. Ayaw nating umabot na sa punto na pagdududahan ng mga kababayan natin, lalo na yung mga kapos sa buhay, ang nireseta sa kanila ng doktor nila kasi sasabihin na may komisyon dyan sa mga doktor at dahil nagdududa na nga, ayaw na nilang bumili ng gamot. Mas lalong lalala ang sakit. Mas lalong lalaki po ang gastusin ng ating mga pasyente. We will conduct the hearing tomorrow to get to the bottom of this issue. At nag-issue rin po ang DOH ng Department Circular 2024-041 calling all concerned to uphold ethical standards. Kung sino man po nag-issue nitong ethical memo about ethical standards, dapat kayo mismo ay maging good example. Siguraduhin nyo lang po kung sino yung nag-issue ng mga memo na ito na kayo rin po ay sumusunod sa ethical standards. Sigurado kayong hindi rin kayo tumatanggap ng mga mamahaling sasakyan. At we will conduct the hearing tomorrow. Rest assured, magiging patas tayo sa hearing na ito. Pakinggan natin ang lahat ng involved. Ang importante, lumabas po ang katotohanan, mapanagot po kung sino po yung may kasalanan at patuloy na naisusulong natin ang interes at kapakanan ng mga kababayan natin. Lalong-lalo na po yung mga mahirap nating kababayan na nagkakandahirap pa po maghanap ng pambili ng kanilang gamot. Ang hirap pong maging mahirap. Dapat po itulungan sila, hindi pagsamantalahan. Maraming salamat, Mr. President.